Thank you for joining us today on the program. Well, yes, the authorities, everyone, at least they say they're doing what they can to ensure keep us all safe. Could you give us a picture? Where are we in this whole scenario in terms of getting us safe at the moment?
Good morning, Mr. Chamberlain. It's my pleasure to be here, really. Like you've seen, from what you've just shown, the cases are increasing, but that is not to say that the situation is getting bad, no. In the past few weeks, you will see that there has been a sudden increase in the number of test sites. So more cases are being tested, and that is actually what is leading to the increase. But when you look at it generally, you compare what is happening in Nigeria and what is happening globally, you will still give credit to Nigeria.
Why?
Importantly, when you look at the global picture, the case fatality rate is in the region of 5%. When you come to Nigeria, what is the case fatality rate? It is less than 2.3. Presently, it's 2.27. That is to show that less people are dying in Nigeria compared to other places. That is less than half of what is happening elsewhere.
What about the reasons?
The cases, we didn't start that way.
Yeah, tell us about the reasons. Is it because are we doing something better than the other countries, or because it came to us late and we shut down at the time we knew something was going wrong?
You know, when you are talking about COVID, you look at the different pillars. You are talking about the detection of cases and equally the treatment. People that are getting infected, are they receiving their treatment? Yes. We try as much as possible to ensure that we capture as many that are coming down with the disease, and as well to ensure that those people that are getting infected receive proper treatment. So it's both ways you look at it. The detection is improving, and again, the people that are infected are getting better treatment. And that is one way to look at it. And again, it's a function of the people's action. You cannot, the health facility treat what comes to them. But again, we are trying our best to ensure that people don't even go to the health facilities. That is, what I mean by that is that when people don't fall sick, people are not infected, they don't go to the hospitals. But as long as you continue to get more people getting infected, it's going to be a challenge to our system. And we pray it doesn't overwhelm the system as it is now.
You know, when you say in terms of the treatment, we're getting better treatment, could you shed a little more light on that? Because, I mean, one wonders, the rates, you talked about the attitudes of the people, how we're handling all of those. So what advantage is it in terms of the better treatment which you refer to?
You see, initially when this whole thing started, most states didn't have isolation center. They don't have treatment center. But over time, within a short time, most states have been able to create isolation center, treatment center, and also, like we keep on saying, COVID-19 is a new infection. Everything that is being done now is being learned as the process goes on. So, importantly, when you get people early enough presenting and coming to the health facilities, they begin to receive management, you know, early also, and that's usually improves the outcome or the prognosis of the patient.
You've spoken to the percentage of fatalities, but you haven't spoken to, and I'd like you to, the percentage of recoveries. Global recovery percentage is well above 50%, but on our side here, it doesn't look like it's up to even 40%. Is there an explanation for that?
No, it does. You know, you see, there are protocols to this. It depends on how you want to place your discharge. Initially, when it started, you have to do 2 negative tests. for you to be discharged. But more information are revealing that even one test may be good enough to discharge a patient. And again, more information are coming out again to show that after 10 days or 10 to 12 days, it is not likely that the patient who has commenced treatment infects others. The whole process of isolation is to ensure that that individual, that patient, does not infect others. Because even before 10 days, they are okay. Many of them walk around, but you still don't want to release them. It's not that they're not recovered, but you don't want them to go out and transmit the infection to other people. So what we try to do with recovery is that by the time you are leaving them to go to integrate with the societies, don't want them to continue to transmit. So that is it. Relatively, Nigeria has done well. So you can see over 10,000 people have been discharged with only about 15,000 active cases. So we are not doing badly at all.
We are doing very well, there's no doubt about that. But I'm just asking if there is an explanation for the rate of infection being so much higher than rate of recoveries. I mean, globally, it's well above 50%. Ours is not up to. That's what I'm asking. There's no doubt about how well we're doing, but the outcomes are slower than the rate of infections. Is there an explanation for it?
The explanation is still what the protocol says. If the protocol says discharge after 10 days, I bet you more than half of the people who are in isolation now will go home. But if the protocol says discharge after one negative test, that means the individual will have to stay a bit longer. So the way it is actually a function of what you place as your standard for the discharge. So for now, people are in isolation center. But I must tell you that for people to stay for 7, 8, 9 days without showing any symptom, without being sick, shows that they are definitely going to be discharged.
So, light on this. I mean, when you talk about us doing better, getting better treatment, the rate of fatality is lower than globally, because we've seen in some of those other countries where the fatality rate is higher, they're usually the elderly, they've got underlying symptoms, but we have a young population here. We've seen many people say time and again they are asymptomatic, and so naturally expect, I mean, as we know, unless there's something different, that they have a higher chance of survival. So what picture do we have in order for us not to get a false impression that, yes, we're doing something better than some others?
You are absolutely right. You see, like the whole issue about the COVID-19 is being defined. We can't say we've actually gotten the final definition, or up to now, symptoms have been collected, you know, the various signs and the manifestation of the disease. Yes, it is expected that the younger, even abroad, you still see the younger population, because those are the people that are very mobile, they move around. It's not that the only challenge there is that they have more of the older generations in circulation. But when it comes generally to those that are infected, the entire age group, none is exempted. So it affects the young, it affects the old, but the older people with comorbidities are likely to die. But if the case fatality rate is reducing, what it means is that the people that are getting to the treatment center, many of them are not dying.
Well, so what do we expect in terms of treatment or getting a vaccine or discovering any of such things? Where are we in that stage? Or are we still going to rely on what other countries discover?
You see, I want you to understand something about this issue of vaccines. It is a process, and it takes a lot of trial. That's why it's very expensive. HIV/AIDS has been with us for years, more than 40 years now. Up till now, we've not been able to get vaccine that will absolutely cure HIV or other diseases. So we are not expecting any magic bullet with COVID-19. What I will tell you is that the researchers are trying the process of vaccine is very expensive and it takes a long period before you can achieve. So we don't really want to rely or begin to wait for vaccine. But there are measures that have been taken globally. It's not different anywhere. These are the ones we've been emphasizing even in the country. We talk about social distancing, wearing your mask, washing your hands, you know, using all the measures that have been said. You know, I want people to believe that those are the countries that have achieved some successes. These were what they used. They didn't use vaccine. They didn't depend on the medicines that is coming, but they just prevented themselves from getting the infection.
You're saying we shouldn't put our hopes in any vaccine whatsoever, especially because you hear that the United States just recently bought almost all the supplies of remdesivir. But, you know, regarding the position we're at now, okay, we're not looking at vaccines or drugs whatsoever. We need to prevent, as it were. Is there that national strategy, really, that tells us what milestones we're trying to achieve? So this is how long it might take. We understand this is going to be, as I say, an endurance thing, not a sprint. So is that national strategy, really, that people can look at and say, okay, this is where we are, this is where we ought to get to, and this is how we need to conduct ourselves? Is there anything as such?
Absolutely. Just like has been said by the PTF, those are strategies that are being followed. There was a time there was lockdown. There was a time that there was an easing the lockdown. And so these are strategies. And I must tell you, the Honorable Minister of Health, with the entire team, the various pillars, the port health, the case management pillar, NCDC, everybody, the researchers, NIPRID, NIMA, everybody is involved in this. Yes, national strategy has been developed, and also the Honorable Minister has also instituted some renowned researchers. There are groups that are discussing all this to ensure that we maintain, we continue to ensure that over time we gradually move from where we are to a better situation, in the sense that the disease is going to stay with us for some time, but we really want to ensure that it does not cause more harm. More people are no longer dying. So there is actually a national strategy to that effect.
When you say there's a national strategy, a strategy usually comes with, you know, indicators that says, okay, we're doing fine, we're doing well. And that's the question here. Do we know the cases we want to be recording on a daily basis? Do we know how low we want them to get to? Because I haven't seen anything like that. I haven't seen, you know, a document that says, well, we're trying to reach this level. I know you've talked about the lockdown, the phases and what have you, but, you know, we need to have this KPI such that people can look at it and say, oh, we're not measuring up. We need to sit up. I have not seen anything like that. Maybe there is, so maybe you can tell us then.
You see, like, this is a pandemic involved. The whole world is involved, and we are not in isolation in this case. In as much as we are trying to do something, we equally look at what the other countries are doing. We look at what the researchers are bringing to the table. So we are moving gradually. There is, like I said, it's a disease. We are only dealing with it because we know the family it belongs to. And if the manifestation of that family of viruses behave this way, let's follow it this way. But I must tell you, nobody will come categorically and tell you that this is what is going to turn, what is going to be in the next. So everybody is waiting for the second phase. We are waiting for the peaking, which we say we don't need to wait to get to those steps. That's why we're saying use the preventive measures.
Yeah, Doctor, we get your point.
Now
but part of what we're asking is that, I mean, we're seeing some other countries there. I think the point is, what threat level are we on in order for us to measure and have an idea how we need to conduct ourselves, whether or not we're adhering to those policies or not? They thought your office should have been guiding perhaps the country or the task force so that they could come up with something, a measure, standard of measurement or something. Is that out of place?
Not. And we actually, like the agency that is spearheading this process is NCDC, working with the entire team of the Federal Ministry of Health and other ministry. It's no longer the issue of Ministry of Health. COVID goes beyond health.
Pardon me to jump in. What can you tell us about the situation in Kogi and Cross River, since you say we're doing so well?
The Honorable Minister of Health sent a team to Cross River State, and the Honorable Minister has been communicating with the Kogi team. So, you see, that's why I say it's not the issue of health alone. When you are talking about a pandemic like this, it involves all sectors. The health is involved, like aviation just spoke now, and we have is an inter-ministerial thing. It affects every system. So I must tell you that the Honorable Minister is working to see a team, like I said, a team went to Cross River to see the situation of things. And also, there is a lot of discussion going on with the Kogi team. So things are actually taking shape. And I must assure you that in a few days, we'll begin to see the reports. Like Kogi State is expecting some of the testing machines. Cross River State is also expecting some. And so many things have been done to ensure that we don't leave any gap in ensuring that things are done properly to ensure that the disease does not go beyond what we are currently experiencing.
Okay. For measurement. All right then, Dr. Ntafon, thank you for your thoughts this morning.